We all buy health insurance for that feeling of security, right? That financial safety net for when the absolute worst happens. But what if that net is full of holes? And what if they were put there on purpose? Today, we are diving into a really terrifying idea. Your out-of-pocket maximum isn't a ceiling, it's a trap.
Wow. That sentence, it just captures a nightmare so many people face. It's the story of someone who followed all the rules, saved their money, planned for the future, only to find out the game was rigged against them from the very beginning.
So let me tell you about a woman named Jennifer. Now, Jennifer wasn't just good with money. She was a professional financial planner. This was her job. She had a 6-month emergency fund, a maxed out 401k, a great health insurance plan through her employer. She thought her worst case scenario was hitting her $8,000 out-of-pocket max. And you know what? She could handle that.
And then she found a lump, a treatable stage 2 breast cancer diagnosis. 18 months later, she had paid $37,000 out of her own pocket. Her emergency fund? Gone in 4 months. A year in, she's $11,000 deep in credit card debt. And not long after that, she had to take a hardship withdrawal from the retirement account she had spent 20 years building. She survived the cancer, but her financial life, it didn't.
Jennifer's story just shatters this myth that we all want to believe, that our insurance policy's out-of-pocket max is this magical shield that protects us from financial ruin. The truth, as she found out, is so much scarier.
Just look at this disconnect. The promise versus the reality. We pay all this money for protection, but here's the hard data. A huge study in 2019 found that 2/3 of all personal bankruptcies are tied to medical issues. But here's the real shocker. Nearly 3/4 of those people, they had health insurance. So how on earth does this happen to people with good insurance? Well, it turns out the system isn't just broken, it's a meticulously designed game. Let's call it the medical roulette trap. And the scary part is, we are all playing, whether we know it or not.
Now, this isn't about random bad luck. The trap is a set of specific, predictable mechanisms that are designed to work together to push costs onto you, the patient, right at the moment when you are at your most vulnerable. Okay, so let's pull back the curtain and break down this trap. It's not just one thing, it's 3 different gears in a machine, all grinding away at your savings. And understanding them is your first line of defense. All right, first up, the calendar reset. This one is sneaky. Your out-of-pocket max is an annual number. So let's say you get diagnosed with something serious in October. Your treatments will almost certainly stretch into the new year. Well, that means you could hit your $8,000 max for November and December, and then on January 1st, boom, the counter resets to 0, and you start all over again paying another $8,000 for the exact same illness. Next up, claim denials. And listen, this isn't some rare occurrence. It's the business model. Insurers deny nearly 1 out of every 5 in-network claims. Think about that. For every 5 procedures your doctor says you need, your insurer just says nope to 1 of them, leaving you to foot the bill. And here's the kicker. This is why denials are so profitable for them. They are betting on your exhaustion. They know you're sick, you're scared, you're drowning in paperwork. And the result? Fewer than 1% of patients ever appeal a denied claim. Most people just give up and pay, which is exactly what the insurance company was counting on. And finally, we get to what might be the most sinister part of this whole trap: out-of-network charges. You do everything right. You pick an in-network hospital, an in-network surgeon, but oops, the on-call anesthesiologist that day was out of network. The lab that processed your blood work, same story. You don't choose them, you can't refuse them, and their massive bills often don't count toward your max. Now, laws like the No Surprises Act are trying to help, but they don't cover every single situation, leaving these huge gaps you can fall right through. So here is the single most important thing to understand about all of this. These traps, they are not bugs in the system. They are features. The system is not broken. It's working exactly as it was designed to maximize profit by minimizing how much they pay for your care. Let's actually do the math here. Let's look at the real cost for a typical family with insurance through their job. It starts with the premiums. Before you even see a doctor, you're paying, on average, $6,000 a year. That's just for the privilege of carrying the insurance card. Okay, but that's not all. Then comes the deductible. Before your main coverage even kicks in, you have to pay this first. For an average family, that's another $3,000. So we're already at $9,000 out of your pocket before the insurance company has paid a single dime for your care. And now for the big one,
The out-of-pocket max. On top of the premiums and the deductible, a family plan can have a max of $16,000 or even more. So in one bad year, a family could be on the hook for over $20,000. And that's if everything goes right, with no denied claims or surprise out-of-network bill.
So what's the result of a system designed like this? Well, it's pretty staggering. According to the Commonwealth Fund, a whopping 43% of working-age American adults are inadequately insured. That means nearly half of us have insurance with deductibles and copays so high, we literally can't afford to use it when we get sick. Okay, I know, this is a really bleak picture, but you are not powerless here. You can't fix the whole system overnight, but you can definitely improve your odds. So let's get into your battle plan. Here are 5 concrete steps you can take right now. It starts with your money, moves to your knowledge, and ends with your mindset. You have to treat this like a fight, because that's what it is. I mean, studies show up to 80% of medical bills have errors on them. Your job is to become the auditor that no one else is going to be for you. But let's really zero in on that first one, because it's the most important. That old advice to save 3 to 6 months of expenses is dangerously inadequate for a medical crisis. Your cost will explode. A real emergency fund needs to cover your normal bills, your entire out-of-pocket max, and a buffer for the inevitable denied claims and surprise bills. This is your war chest. So all of this, it forces us to completely reframe how we should be looking at our personal finances. You know, your net worth statement, it doesn't show your biggest liability, your own biology. And here's the brutal, honest truth. I want you to really let this sink in. Your 401k, your home equity, that emergency fund you worked so hard to build, none of it is truly safe. As it says right here, your retirement account is not for your future. It's one diagnosis away from becoming a medical expense account. Every single dollar you've saved is just a potential slush fund for medical bills, padding your insurer's profit margin. Which leaves us with a very difficult and very personal question. In a system that's designed this way, who are you really saving for? Are you saving for your future? Or are you just saving for the company that profits from denying you care? Your only defense is to understand the rules of this game before you're forced to play it.